Brandon is a 37-year-old male who has recently gotten over strep throat and is now experiencing orangey brown urine due to hematuria, which is blood in the urine, foamy urine due to proteinuria, which is protein in the urine, and nocturia. Brandon has also noticed swelling throughout his body. When he goes to the clinic, he is told he has high blood pressure. Brandon is diagnosed with acute glomerulonephritis, which is an inflammatory disease of the glomeruli in the kidneys.
Looking at the normal physiology and anatomy of the nephrons, we find the nephrons as the structural and functional units of the kidney. Each nephron consists of a high-pressure capillary bed known as the glomerulus, a glomerular capsule and a renal tubule that is continuous with the capsule, and a secondary capillary bed known as the peritubular capillary that is closely associated with the renal tubule of each nephron. Collecting ducts receive urine from many nephrons and help concentrate the urine. Looking at the physiology of the kidneys, we find the mechanisms of urine formation. Urine formation and the adjustment of blood composition involve three processes. Glomerular filtration, which takes place in the renal corpuscle and produces a cell and protein-free filtrate. We have tubular reabsorption, which is the process of selectively moving substances from the filtrate back into the blood. It takes place in the renal tubules and collecting ducts. Tubular reabsorption reclaims almost everything filtered, all of the glucose and amino acids, and some 99% of the water, salt, and other components as well. Anything that is not reabsorbed becomes urine. Tubular secretion is the process of selectively moving substances from the blood into the filtrate. Like tubular reabsorption, it occurs along the length of the tubule and collecting ducts.
Acute glomerulonephritis changes the normal pathophysiology due to an increased replication of glomerular cells, specifically the endothelial and mesangial cells, as well as an increased number of monocytes and macrophages. This creates crescent-shaped structures. Eventually, this buildup will cause the bone and space to be destroyed. The sudden increase of cellular replication can be caused by different kinds of immunologic disorders that may be systemic or only affect the kidneys. During glomerulonephritis, the filtration rate increases. This means the amount of filtration that is occurring has lessened. This is caused by the capillaries becoming leaky. The leakiness of the capillaries leads to the loss of blood cells, causing hematuria, and proteins, causing proteinuria. One protein in specific, called albumin, is lost. Albumin normally floats in the bloodstream and soaks up extra water. Due to the loss of this protein, there is extra fluid in the bloodstream, which can cause hypertension and increase urination. Glomerular hypertension contributes to the leakiness of the capillaries by causing the widening of mesangial cells, which normally help with the filtration of the capillaries due to their contractility. Hypertension also causes narrowing of the capillary lumen and the hyalinosis of the glomerular tuft. This leads to glomerular sclerosis, which is an increase in extracellular material. This increase causes blood flow to stop, thus stopping filtration. Eventually, the nephron will die. In response to this, other nephrons will have an increase in filtration rate in order to compensate for the loss. This contributes to an increased level of glomerular hypertension in other nephrons. All the damage that occurs to the nephrons can eventually result in renal failure, ultimately leading to death. Normally, if respiratory acidosis or alkalosis occurs, the kidneys will be able to help rectify it by either through reabsorption or secretion of hydrogen ions or bicarbonate ions. If respiratory acidosis occurs, the kidneys will secrete hydrogen ions at the proximal convoluted tubule and the collecting duct, then reabsorb bicarbonate ions at the proximal convoluted tubule and the collecting duct. During respiratory alkalosis, the opposite will occur. The kidneys will reabsorb hydrogen ions at the collecting duct and secrete bicarbonate ions at the same location. During glomerulonephritis, the leaky capillaries are unable to function properly, which means the pH of the body will remain at a dangerous level with serious repercussions.
Treatments for glomerulonephritis include diuretics, which will increase urine production and reduce swelling, medicine that lower blood pressure to counteract the hypertension, and antibiotics are used if glomerulonephritis is a secondary disease to a bacterial infection. If the condition leads to renal failure, dialysis is used, which is using a special machine that does the filtering of blood for the person. For protein, the main protein involved is albumin from the blood, which is excreted through the urine. For cell membranes, the widening of the mesangial cells stretches their cell membranes, which causes damage and impairs its function. Homeostasis is affected due to impaired renal function, including blood filtration and urine formation. Since Brandon has acute glomerulonephritis, his condition was able to go away on its own.